This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, she's an elderly lady who has a phacomorphic glaucoma. When she presented to the hospital with severe headache and vomiting, she had an intraocular pressure of 60 millimeters of mercury. She was treated medically with anti-glaucoma medications and topical steroid eye drops, and she's posted for the surgery the next day. And these are her biometry readings, and it's very obvious that the antechamber is extremely shallow, and we have a task at our hand. Now, before shifting to the patient was put on IV mannitol, 300 ml, and she was also given a peribulbar block with a massage so that the eye was really soft. A soft eye is really beneficial when you want to do surgery in such eyes. Apart from reducing the chances of a rare suprachoroidal hemorrhage, the most beneficial effect would be that the rhexis would become very easy in spite of having a swollen lens. Now, when we have a soft eye and we use a cohesive or a heavy viscoelastic, the rhexis becomes much more easy and predictable. Anyway, I'm planning to do a 2-stage rhexis. So the capsule is stained, OVD is put into the eye, the main incision is created, and now is the time to perform the initial primary small rhexis. The capsule is punctured and the flap is held with the forceps. A small primary rhexis measuring about 3 mm is performed. It was easy. Time to decompress the capsular bag. So I prefer to use the phaco tip itself to decompress. The reason is the swollen cortex will be thick and jelly-like, and it would be much more easier to aspirate it out with the wider bore of the phaco needle rather than the 23G bimanual I&A. It's important to be mindful that we don't tug at this rhexis margin because these capsules are thick and friable, and even a minor stretching can tear this off. So we need to be mindful of that. And once I'm satisfied with the decompression of the bag, time to enlarge it. Before that, again, the chamber is replenished with OVD. Using a micro scissors, a tangential cut is given to the rhexis margin, and using the Dr. Haldipurkar forceps, the flap is held and the rhexis is enlarged about 5.5 mm. And in such cases, the most challenging step or the interesting step is the rhexis. Once we get the rhexis right, the rest of the things are going to be much more easier. The nucleus is relatively soft. It would be around grade 2 to grade 3. The phaco tip is buried into the substance of the nucleus. The chopper is placed right in front of the tip and the chopper goes down vertically, and then there's a lateral separation maneuvers. When I'm doing vertical chops, I prefer to keep all the pieces in the bag until the last division is done. So when you're doing a vertical chop, it's important to have a compact nuclear fragment so that I get a good grip and there's no lateral movement. The nucleus is divided into multiple small fragments, and then each of these fragments is pulled out of the bag and then emulsified. So nucleus management was relatively straightforward, and there's hardly any cortex left now. Using a bimanual I&A to take care of the cortex, the bag looks to be clean. As is customary for me, I just flush the poster capsule with BSS just to clean off any fine fibers clinging onto it. The capsular bag is filled with OVD, and the planned multi-piece intraocular lens is placed into the bag. The proximal haptic goes in first, followed by the distal haptic. Both the haptics are then dialed into the bag. The OVD both in front and behind is irrigated out. The ports are hydrated. Intracameral antibiotics are placed. That's it, the case is done. To summarize, with appropriate planning, Intumescent cataracts are relatively easy and predictable to manage. The important secret here is to have a soft eye. So the capsular tear can be controlled very well, and with a better understanding of the concepts, nowadays, Argentinian flag sign in these Intumescent cataracts is extremely rare. So that was it. Thank you for watching and hope you found this helpful.